Well, today is the World Health Organisation's World Sight Day. In Australia, Vision 2020 is taking the lead, and I want to thank and congratulate everybody associated with Vision 2020 for your leadership and your practical action in this space. In Australia, we know that the challenge of eyesight is that over 50% of Australians, about 13.2 million Australians, have one or more long-term eye conditions that can affect eyesight in some way, shape or form. Across the general population, we know that 70% of long-term blindness is in some way associated with macular degeneration. That's why we're investing $3 million in a national macular degeneration plan to help with the understanding, to help with people to seek early treatment and early diagnosis. And above all else, to ensure that Australians understand that there is support. In addition to that, we've been advancing the Keep Sight program with Oculo and others, and that's such an important way of providing support for early diagnosis and intervention. Within Indigenous Australia, there's a particular challenge, and that's why we've set the very clear goal of ending avoidable Indigenous blindness on our watch, in our time, by 2025. And this is an immensely important project. We're investing $42 million in helping to achieve that goal of eradicating avoidable Indigenous blindness. In particular, together we are making huge strides on trachoma, and this is something that can give young children a very different future from that which they would otherwise have if their trachoma was not treated through early intervention. So I want to thank all of you for what you're doing on the World Health Organisation's World Sight Day, and to urge all Australians to seek early diagnosis, to seek an eye test if they are experiencing difficulties, and to realise that in many cases that early diagnosis and early treatment can make the difference so as people can keep their sight.